अस्सलाम वालेकुम ಅವನಿಗೆ ಡಾಕ್ಟರ್ ಅಮ್ರು ಟ್ರೀಟಪ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಕನ್ಸಲ್ಟೆಂಟ್ ಮೀದು ಮೆ ಬದ್ದು ಕೊಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಪೇಯ್ನ್ ಬೆಹೆಗೊತ್ತುಂ ಕೊಡಕೊ ವಾಹಕ ದಕ್ಕಾಲ ಕ್ಯಾನ್ಸರ್ ಪೇಯ್ನ್ ನಕಿ ಕ್ಯಾನ್ಸರ್ ಬಾಲಿಗೆ ಸಬುಂ ನುಣಿಯ ಕ್ಯಾನ್ಸರ್ ದೇ ಫಾರುವಾಗೆ ಸಬುಂ ಅನ್ನ ತದು ಎ ತದುತ್ತಕಿ ಮಿಸಾಲಕ ಕ್ಯಾನ್ಸರ್ಗೆ ಟ್ಯೂಮರ್ಗೆ ಸಬುಂ ಎನ್ನ ಪ್ರೆಷರ್ ನುಣಿಯ ಹೊಳಿಗೆ ಹಸಿಗಂಡುಗ ಹುಣ್ಣ ಹೊಳಿಗೆ ಬೆದಿಗೆ ನುಣಿಯ ಫಾರುವಾಗೆ ಸಬುಂ ಅನ್ನ ಉಂದಗೂತ ಕೀಮೋಥೆರಪಿಗೆ ಸಬುಂ ಅನ್ನ ಉಂದಗೂತ ಬೊಡೆತಿ ಸರ್ಜರಿಗೆ ಸಬುಂ ಅನ್ನ ಪೇಯ್ನ್ಸ್ ದ ಮಿಕಂತ ಕೀ ಕ್ಯಾನ್ಸರ್ ಪೇಯ್ನ್ ದೆನ್ ಮೀಗೆ ಫಾರುವಾಗೆ ಗೊತ್ತ ದಿಗು ಮುದ್ದತಕ ಅಮ್ಮೆ ಬಲಾಲಂಜೆ ಫಾರುವಾ ಕಿಹಿನೆತ್ತೋ ದೇನಿ ෆුරතම ෆශායරු බේහුන් එකි ලෙවල්ගේ බේස්තන් හොරේ දෙන් මේ බේස් ෆුරතමෑන්නුන් ලෝ ඩෝසෙන් නුනි එහා බාරුගද නූම් බේහකු ෆශයන් ගොස් මති බේස්තකුන් බෙවර බාරු ගද බේස්තක ටයිට්‍රේට් කුරමුන් ගෙන්ද විධානය මිහෙගේ පේන් ලෙවල්ල බලාව දෙම් වෙස් අංගොල නුවඥා nerve block nuni anesthetic aikeki modalities tabenun koggen cancer pain farwa kuredan ekterek spinal block nuni local anesthetic blocks echi use kuraven then mikamuge ehi terve devon or menna ki mege team ge anesthesiologist ves oluba then mege ithura digumudet ka balayro miha ka taduge sabum badive ನುನಿಯ ಮಿ ಆಮ್ ದಿರಿರುಳು ಮಗ್ಗೆಲ್ ಉಂದಗುವಾ ವರಂ ಬಾಲಿಗೆ ಸಬುಂ ಅಣ್ಣು ತದುಗೆ ಸಬುಂ ಎ ವಾ ಕಂತತಕ ಹಲ್ಲೆಂ ಹೋದಂ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಕ್ಲಿನಿಕ್ ಎವ್ವೆಸ್ ಟ್ರೀಟಪ್ ಹಾಸ್ಪಿಟಲ್ಗ ಕುರಿದ್ದೆ ඒක මිතිබ්බවනි ෆිසියෝതെරපිස්ටු දෙන් කස්සත්තක එකි ෆිසියෝതെරපිගේ එකි modalities the me clinic ka lipada ganawan then holistic approach ka balayero hama nutrition na me diet ka benumwa muhimmu maddatan kiya den ane nutritionist ves me clinic ka uluba ehme mihage ka holistic approach ka balayero cancer patient unna cancer survivors of this hama muhimmu clinic ka metam wegen dan then thadu rehabilitation mobility mikantatta rangalo kurang adi ane rangalo ottar horika fada horikana benum kuravene goettaves mi clinicum kiya devan then mi clinic mi mikor treatment hospital ga මෙන්ගේ ඔන්කොලොජි ඩිපාර්ට්මන්ට් දෙකම ෆහු මෙන් ප්ලෑනින් හදාලාන දිග මුද්දතක කීනතෝ මේ ෆරුවාත කුරියක එන්දානි තෙන් ෂෙඩියුල් එල්ලි බඩ ගන්නවානේ ක්ලිනික් දක්කල්ම ෆහු මෙන් ප්ලෑන් කරන් කොන්කොන් pain modalities pain control modalities එතෝ ඒ patient එක එකසිගේ මනි evaluation එක ෆහු then රුමින්ද කරන්නේ cancer rehabilitation pain and nutrition mi kantatta mi ane miha holistic gotaka adi mi kan kuraven furtan fahar then egen aguhuri gina guna faida take patient una liver dan anakam ummid kora
I am Amir Ali, physiotherapist, Treetop Hospital. So when we talk about oncology rehab, Treetop had a wide range of therapies that we have electrotherapy, we have exercise therapy, we have speech therapy, we have occupational therapy. So when a patient comes to our side, we will first assess the patient and we will set a treatment plan. So according to that, we will treat the patient. So when the patient is coming with pain, it may be due to some stiffness or may be due to the spasm, joint spasm, or maybe due to the fluid retention. So we will According to that, we will treat. If it is due to the stiffness, we will do exercise therapy also along with the pain relieving modalities. Then we have exercise program. Mainly, it is we have to do a program for that. First, we will teach the patient mild exercises because the patient will be having fatigueness. So slowly we will teach the exercise, and if the patient is patient have an average strength, we will start resisted exercises. For that, we have treadmills, we have cycling, we have leg press, we have almost all gym activities facilities. So that we will utilize. And for the patient who having pain, we have pain relieving modalities, that is especially transcutaneous nerve stimulation, interferential therapy, infrared or heat pack, like that. Then the patient, if they have any sensory issues, we will advise to occupational therapy. They have more treatment in that session. And for speech therapy problem, especially in dysphagia management, the speech therapist, they have a good role in that function. So we will do that also. So this is all together. We have oncology rehab, speech therapy, occupational therapy and physiotherapy.
Hello, this is Reba as a clinical nutrition in a Treetop hospital. So I'll be supporting through the diet counseling with according to the weight loss or post-cancer treatment, the causes will be that. With that, we'll be providing the menu chart with a diet chart, will be with a high calorie and high protein. More of counseling will be giving, and we will give you more antioxidant food which is really required for the prevent the cancers. Speaking to the dietitian is really important to our cancer treatment, because post and pre-treatment there will be a weight loss. To overcome the weight loss, you have to be speak with a dietitian for include a more nutrient in the diet.